discover the stimulus. The elephant in the room this holiday season: access barriers.
Part 1. The Unsettling Public Health Reality and a Triad of Systemic Betrayals.
As 2025 races into an unnecessarily melodramatic close, a deep structural failure in the nation's healthcare system is being exposed. Access to affordable health insurance is rapidly moving from a risk to a near-certain catastrophe for millions, with major uncertainty looming for New Year's Day 2026 and beyond.
And for Black, African Americans, and other marginalized groups, this financial cliff is compounded by a healthcare system that has historically and contemporarily betrayed our trust.
Let's look at this triad of systemic betrayals.
What's the first one?
Censorship and suppression of medical professionals. ProPublica has exposed that the Indian Health Service, also known as the IHS, the federal agency tasked with providing care to American Indians and Alaska Natives, is allegedly flagging vaccine-related speech. Doctors within the IHS are reporting that they are being censored, suggesting that critical medical dialogue is being actively suppressed within a government health institution.
That is a fundamental breakdown of trust, and it ties directly into the second point: negligence and disregard in patient care. NBC Chicago 5 reported that a doctor and nurse were both fired for the shocking discharge of a Black woman in active labor just minutes before she gave birth. This isn't a failure of policy, but a direct, dangerous lapse in the fundamental responsibility of healthcare providers, particularly impacting a vulnerable patient in a time of crisis.
And those present-day experiences of discrimination directly influence decisions about healthcare and create a justifiable foundation for hesitancy among Black communities.
Which brings us to the third, perhaps most unsettling betrayal: the resurgence of discredited misinformation. The credibility of the Centers for Disease Control and Prevention, also known as the CDC, is now under siege. Both NPR and KFF News publish reports dissecting the agency's actions.
That's right. NPR ran the headline, "The CDC revives debunked link between childhood vaccines and autism." KFF News followed immediately with the assessment, "What to know about the CDC's baseless new guidance on autism."
This means the nation's foremost public health authority is unnecessarily and without basis reintroducing a disproven narrative that endangers public health trust and undermines essential vaccination efforts.
And yes, as we all unfortunately know, what we are witnessing in real time is just the final weeks of, we'll call it Act 1 of what is no doubt going to be a very, 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 very long 4-act drama over the next 3 years, complete with over-the-top sound effects, unrealistic stunts and caricatures, smoke, fog, snow, a kitchen sink, circus clowns, fairy tales, hot air balloons, a lot of gas, and more.
And yes, we can't wait. But before we all rush in, let's slow down for a moment and think about how we got here and consider things that we can do better over the next 30 days and beyond.
Let's talk about what's playing in our face and adding insult to injury: the cruel irony of health observance and awareness campaigns that ignore access barriers and the most vulnerable.
Against this backdrop of systemic breakdown and betrayal, some public health agencies, organizations, and advocates alike may choose to proceed cautiously this December with cute, warm and toasty, sugar-sweet, holiday cookie-cutter-themed messaging like the Winter Wonderland vaccination hand-washing toolkits.
That messaging amplifies the importance of hand-washing and influenza vaccinations, while ironically ignoring the mountain of barriers that diminish access to vaccinations, updated immunization records, clean water and air, a living wage, health insurance, preventative, primary, and emergency care, and equitable public safety standards in schools, places of worship, and the workplace.
And in the same way, we may also see playful winter wonderland-themed messaging that generically amplifies persons living with disability, HIV or AIDS, and their caregivers.
While conveniently refusing to draw a straight line to the specific policies that are creating an exponentially higher wall of access barriers to prescription medications, health insurance, providers, physical therapy, disability rights, public accommodations, and other relevant wraparound services.
Yes, public health efforts must acknowledge the calendar. December 1st is World AIDS Day, and December 3rd is the International Day of Persons with Disabilities. But effective messaging campaigns aren't just cheerful social media posts. They are, when used correctly, tools that we can use to address structural issues collaboratively with others more quickly.
For example, studies show that people with disabilities are 20% less likely to have inclusive knowledge about HIV. And for those with HIV, stigma and eligibility rules can create a formidable barrier to accessing life-saving care before they reach a disabling AIDS diagnosis.
So, see, we can all do better, and we will. In any case, let's remember that tone of messaging will fall flat, as always, because vulnerable communities recognize that gimmicks and pageantry do little to speak to the moment that we collectively experience or to advance genuine efforts to build trust and coalition in the midst of chaos and theater.
Moreover, contrary to popular belief, and in spite of the efforts of those who seek to downplay the volume of ongoing and emerging trauma that is already in progress, this holiday season is not defined, nor will it ever be remembered, by one-dimensional observances without context, festivals, parties, pageantry, and gimmicks, but instead by the unsettling friction between federal health policy, dangerous medical negligence, the inaction of those who bear witness to what's going on but refuse to say or do anything to help, and the growing, urgent needs of a population that is about to lose its safety net.
So let's get some rest, because we're going to need it. Have a safe holiday, Happy New Year to all of you, and as always, let's stay alert, prepare, and survive.